We would now like to begin the press conference by Prime Minister Suga. First, we would like to hear from Prime Minister Suga. And then we would like to entertain questions later. Prime Minister, floor is yours. Shortly before, we had a task force for COVID-19 in Saitama Prefecture, Chiba Prefecture, and Tokyo, and Kanagawa Prefecture. In these areas, for 2 weeks, we will extend the state of emergency up until the 21st of March. After January, when we started state of emergency declaration, the great impact has been coming to the fore. New infection numbers across Japan has decreased over 80%. In Tokyo, as a gauge for lifting, the 500 per day has been coming to below. Today, 301. Number of the hospitalized and the number of critical patients have sustainably come to decline versus other countries, which put very strict lockdowns. And without those strictures, the efforts were made and we had made unity and we all strove to these goals. Medical service and care home services, as well as the older people across Japan, have given us the effort. Thank you. Now, as for the lifting of a state of emergency, number of new infections and also bed occupancy ratio will be the gauges, and then based on which we will make decisions. And that's what we said. And the 4 prefectures, including Tokyo, almost all the gauges have met these criteria. I have to say, however, there are some regions with a high occupancy ratio, and we have to see we are still in a tight spot. And infection numbers tend to decline. Still, the growth for infections have come into decline, and still there are more traffic, and so-called rebound risks has come to the fore. For 2 weeks, we need to conquer the virus, and we need to be very, very circumspect for our activities. We need to be cool-headed and we need to see the situation on balance. So as a Prime Minister of Japan, I decided to extend the state of emergency. Originally, I promised the 7th of March, we were supposed to lift the state of emergency. However, we couldn't do it. And I truly feel sorry for that. And I would like to extend apologies. Restaurants and bars need to operate in a shorter hours, and we needed to have to ask for people to hold back going out and teleworking, and these measures were implemented by working together with the local governments, and we continue the efforts. And also infection need to be detected much earlier on so that we can contain the cluster infections. So 30,000 facilities we will execute the testing. And also we need to detect the community infections, so asymptomatic patients need to be monitored by testing. In Tochigi Prefecture, that's where we start the program. In Metropolitan area, we would like to extend the program. Especially, people tend to take off masks in taking dinners and meals, and these are the areas with the focused efforts. Spring, graduation ceremony and entrance ceremony, and also farewell parties. And these were the very important milestones for people's life in spring. And also, there are many moments that people come together. The end of last year, because of the year-end party that has driven the infection surge. That's what some people said. Even though with these very important milestones, dinners or meal taking with a large number of people needs to be held back. Even you are in the region without any state of emergency, I ask you to have meals with the family members or with less than 4 people. Not only with these measures, TV commercials and SNS and these measures will be implemented so that we are able to communicate these messages to youth. And these are the PR activities we would like to focus. These countermeasures in restaurants and bars, of course, we will work together with the local governments to enhance and ramp up our efforts to increase our effectiveness.
From business owners, extension or business continuity has become difficult and there are serious voices shared. So as for the Japanese government, we'd like to make sure that we provide as much support as possible on a continuous basis. And securing enough number of beds and coordination with hospitals. And if we have to coordinate with the local municipalities, then I will take a lead so that we can break silos to be able to rectify the situation. Last month, for HCP's vaccination program have kicked off. I visited the site, and we'd like to make sure that people have no reservations coming to work, and vaccination program has to be utilized as much as possible. Such voice was heard in order to protect the front line. Vaccine has to provide hopes for people. So that's what I felt in the field. And the people who will be vaccinated, it used to be 3.7 million. However, more than 1 million people are expected to have the vaccination. And starting on the 12th of April, for all the elderly people across Japan, we will kick off the vaccination program. And from the end of April, the scale will be ramped up significantly. And as anti-infection measures, to all the people who want to have the vaccinations as much as and as soon as possible, we'd like to provide such a service. And so far, around 37,000 people have been vaccinated so far. And about side effects information and including all that, easy to understand information will be provided. And together with local municipalities, we'd like to go ahead with preparations work. And about new variants, local spread was not confirmed. However, last year, since the end of last year, in 19 prefectures, there was a confirmation of the variants. So on a continuous basis, we need to stay on alert. And starting this month, the new variants can be detected in a short time of span using a new testing method that will be implemented for all prefectures so that we can evaluate the monitoring system across the board. At the same time, border control measures and as new measures for all the entrants into Japan and for all the re-entrants, there will be quarantine for 14 days. And then on top of the GPS information of mobile phones and via phone calls, we will be able to check their locations and or status. And now we have a protracted situation of the COVID-19. And for businesses and for livelihoods of people, we have a serious issues and impact. So for eateries and accommodation and transportation in local areas, there are many businesses suffering. So livelihoods and life support and employment adjustment funds will be provided. And for cash management and cash flow, enough fundings, and depending on the situation or the scale of various relief programs will be put in place, and we will consult for each individual owner so that we can provide cordial efforts and support. And last year, we have had more women killing themselves. So that's very painful to hear. So countermeasures are immediate, have to be immediately provided. So for single parents and for others, the people who are having difficulties being hired, trainings and skill upgrading programs will be expanded to a significant level so that they can get their desirable jobs as much as possible. So we'd like to stay close to them, to their needs. And people need to refrain from their outings, so therefore undesired solitude and isolation is something that is inflicting a lot of people. The other day, the supporting volunteer and representatives for those people gave me quite painful experiences and information, and we feel that we need to provide efforts across the society. So monitoring children and the prevention of suicide and consultation organizations have to be supported in a proactive manner.
深刻な問題
Against these serious issues, some point this month, the relevant ministers' meeting will take place, so that emergency program will be formulated. Across the world, the fight against COVID-19 still is here today. But still, versus European countries and the United States, our infections are overwhelmingly low, and the number of unemployed people remains low. That is because over the past year, companies and people were so serious and so earnest in their efforts, and we have started to see those results and fruits. So as a Prime Minister of Japan, my job is that we make sure these results will maintain and contain the rebound, and so that we can lift the state of emergency. We sometimes lack. Some people say so, and some say we are at the edge. And of course, I'm aware of these opinions and views. Of course, I contemplate various thoughts running through my minds while listening to these voices, and then I decided to ramp up our efforts. I truly feel sorry for my people across Japan, but life and living of yours need to be protected, and also bustling and safe lives need to be safeguarded. That takes efforts and cooperation from you. That concludes my speech. Thank you. With that, I'd like to entertain questions from the floor. Dr. Omi, would it be possible to move to your prescribed position? Dr. Omi might answer to your questions. If appointed by MC, please approach to the closest mic, and please state your name and affiliation, and please limit your question to one. After asking questions, please return to your seat, and no additional questions might not be accepted. First, leading press club. Hoshino-san, go ahead from Asahi Newspaper.
Asahi Newspaper, Hoshino. This time around, the state of emergency declaration was extended once again, and you apologized for the people of Japan. Where do you think the reason lies? Do you think the messaging for containing the virus by Prime Minister, was it enough? And the anti-infection measures were talked about, however, new infections are not declining enough. For 2 weeks, do you think you can lift the state of emergency after containing the virus? And what is the scientific ground? First of all, after the state of emergency declaration, and depending on the anti-infection measures, in terms of all the indices, or many indices, stage 3, in this regard, around Tokyo and Greater Tokyo, or in all, we were able to meet the criteria. However, bed utilization ratio, and in this regard, or in some indexes, we are still hovering at the very border. So amid such a background, so we have to take a cautious decision. And in order to prevent any backlash, first of all, we need to extend for another 2 weeks up until March the 7th. So we were supposed to have the declaration and we couldn't make it happen. And candidly, I'd like to extend my apology. And regarding my messaging or how I communicate about the on top of shorter business hours for E3s and unnecessary outings being refrained. And in this regard, endorsed interviews. As part of such context, I tried to communicate my message, and regarding the outcome, it's really up to the people of Japan how you decide. And this time around, TV commercial will be staged and SNS will be utilized so that, and video messaging will be also provided as much as possible to young people and to a broader scope of Japanese people. The advertisement or PR is going to be doubled. And with that determination, we'd like to carry out the measures thoroughly, at any rate. So based on the basic response policies, what is required needs to be cleared in a solid manner. And even when we have the next wave of infections, we need to secure the beds enough. And that's what we'd like to establish for another 2 weeks.
それでは続きましてテレビ朝日の
Going on to TV Asahi. Yoshino from TV Asahi. My question concerns what will be ahead. Prime Minister Suga said the 2 weeks will be designed to watch ahead. So what situation will dictate you, will enable you to lift the state of emergency? What will be the criteria for new goals? And as you rightly pointed out, the reason for extending the state of emergency has been the occupancy ratio. What are any countermeasures, additional countermeasures against those beds? And you said 2 weeks, but after 2 weeks, that will be the spring vacation. How much is there any possibility to re-extend the state of emergency? Well, as a goal, for example, in Tokyo, the stage 3, new infections are 50, and occupancy ratio 50%. The new infections are declining, like 301 today, and occupancy ratio, Tokyo, that has made the cut, but there are some regions with meeting barely 50%, and I have to say it's still stretched. And all the beds occupancy ratio needs to be below 50%. So that effort still needs to keep on. And these arrangements need to be created in place. So that's something we have to do over the next 2 weeks. And this anti-infection measures and conversation without any wearing masks shows high risks. Also, meal taking, graduation ceremony, entrance ceremony, and farewell party will be coming in the spring. So amid the situation, anti-infection measures need to be root and branch that need to take place. And as I touched a bit, 30,000 elderly facilities needs to go through testing in March. That's what we would like to achieve. And also monitoring testing in towns for asymptomatic patients. These measures needs to be done so that we are able to quell the virus, an outbreak. So we need to see the bed occupancy ratio with enough leeway. And at the stage when infections are surging, we all need to be well prepared for the next eventuality. Dr. Omi, would you like to supplement a bit? Yes, 2 notes from me. This time, as Prime Minister said, the conditions for lifting state of emergency has been already met actually. The number of infections, still we are already at stage 2. And Chiba Prefecture is barely meeting that, but still stage 3, and we are able to be out of the woods already. And many of people might think that Osaka and other prefectures will lift a state of emergency 1 week ago, and this time, why we met these criteria, but still extended state of emergency for another 2 weeks. However, this is very important juncture here today. And how I see the situation at the moment, well, you asked the question of the criteria for lifting a state of emergency. One is the burden for medical services. We are at stage 3, barely, but it's not really stable trend, so we need to make an effort more. One is that we need to contain the virus outbreak, and also medical readiness need to improve. In other words, we need to increase the number of beds. So these are the things we need to do. And why metropolitan area need to prolong the state of emergency for another 2 weeks? Why? Because, in short, this is a characteristics or traits of a metropolitan area, as we have said before numerous times, because metropolitan area is an important area in space when we look at the outbreaks. And there are many traits, geological, like populational area, and also amusement area, and there are a variety of community that exists in metropolitan areas. And also many people live here. Also, Tokyo is a big government, so 23 wards and public health centers, staffs, and of course there are various efforts still underway. But because of the much sheer size of population, it's sometimes difficult on top of the people being anonymity. And we often talk about in-house infection and office infection. And of course, there is some reasons why that cluster occurred. And oftentimes we find out those cluster infections. But when we look at the in metropolitan areas, the very source of cluster will not necessarily be able to be detected. And we often pay attention to the results. So that's the critical challenge here in a metropolitan area. So as you, reporter, asked the question of the criteria, I believe there are 2 factors. One is that the government had set some standards. Medical readiness burden need to be lessened. And at the same time, infections are declining now, but we need to make sure these infections are not coming back to stage 3, and that needs to go further down. And that's something I have mentioned many times before. And second, we prolonged the state of emergency. And why we did this? Why? Because we need to pay attention to what we have to do over the next 2 weeks. That is in function of a medical readiness in infection. And one more, this is the very nature of a metropolitan area. That is the source of the cluster were not known, and we are not easily detecting those. So the risk and the probability for rebound is relatively higher than other countries, other regions. So that's why over the next 2 weeks, we need to pay attention to that point. So if we lift the state of emergency, to an extent, the infections will go up, and we need to make sure that going up trends shouldn't hit the higher stages and the rebounding. So next 2 weeks, we need to make sure we will do that. Of course, there is a 1 week difference. This is not a matter of 2 weeks or 3 weeks, but within the set period of extended state of emergency, anti-infection measures against the rebound need to take place. Of course, that's in function of medical readiness and also the reducing the number of infections. So these 2 weeks are the weeks that we need to take actions against what we have seen as a problems. So these are the important factors we need to take into account.
それでは幹事社員
Now we'd like to take questions from other outlets. So people who want to ask questions, please raise your hands. So we will nominate who can ask a question. Please proceed to the microphone. And we'd like to limit the number of questions to 1 for each person in order to assign the questions, as many questions as possible to as many people as possible. Kurami with Yomiuri newspaper about Go to Travel campaign. Today, in the upper house or budgetary committee, even with on the 21st, if we have the lifting of the emergency, we will not be able to lift everything, you said. However, what is the projections regarding the starting of the Go to Travel campaign about the state of emergency declaration, and we have now extension, and about Go to Travel campaign, for the time being, it's not going to happen for some time. And we need to see infection numbers and the status in each region, and we need to listen to opinions of each expert to exercise a decision. At any rate, in each region, infection status needs to be taken into account because it varies from region to region. From various regions, we have different requests from each prefecture, for example. At the end of the day, however, we need to listen to opinions of experts to exercise a decision. For the time being, it will be difficult to restart the campaign.
それでは次は
Next question. Yoshino-san from Kyoto News. Yoshiura from Kyoto News. Thank you. Tokyo Olympic and Paralympic Games and taking overseas tourists and Tokyo Organizing Committee and IOC. There were 5 parties meeting took place, and tourist invitation will be decided in March. The so-called border control will be determined by the Japanese government, I believe. New variants were detected here in Japan, and still around the world the infection still is in a tight spot. But in order to have a safe and secure Olympic Games, do you think it's possible to invite a foreign tourist? And also, the end of last year, there was a coordination meeting, formulated intermediary report, and right pre and post arrival, 2 weeks, 14 days measures and public transportation system, and these were something they have discussed. Do you think that you are able to gain understanding of these from Japanese people? Well, you talked about the countermeasures if we take a foreign tourist. Well, we haven't decided whether we do it or not. So I would like to hold back that comments. But at any rate, the other day, the chairman Bach of IOC, including him, this 5 parties meeting took place, and the decisions will be made some point in March. And that's what the 5 parties discussed and agreed. And because of the new variants and also the infections around the world, including Japan, need to be seen. So IOC, IPC, Tokyo Organizing Committee, and these are the parties that needs to consider them. And within the 5-party meeting, the Minister Marukawa said new variants possibility cannot be predicted now. And then whether or not we take a foreign tourist from overseas, it's very, very difficult to predict it just now, and we need to be careful about it. That's what she said.
それでは
Now, freelancer Egawa-san. Yes. Freelancer, my name is Egawa Shoko. About the young bureaucrats quitting their jobs in many cases, and they are quite busy, and Black Kasumigaseki has come up as a buzzword, and for anti-COVID measures, they need to work overtime a lot. And at the same time, mind-boggling entertainment is happening to some bureaucrats, and with a lot of your efforts, you tried to control bureaucrats by policymakers. However, it seems that the system is stuck, and there are some calls which are saying that there are some problems in terms of anti-infection measures. And how do you see the relations between Prime Minister's office and bureaucrats? And do you have any points of reflection or any things that need to be reviewed? And with a third party involved, do you have any intention to review how it should be? What is your take? About the young bureaucrats quitting their jobs halfway through. This is very regrettable. However, there are some who leave their workplaces and come back in some cases. But we have a liquidation or mobility of the people around the different workplaces. This is important. However, rather than giving up halfway through, as a next step, we need to provide more opportunities for transfer for young people. And about entertainment, and there are many issues which are drawing a lot of attention. And we have an ethics law associated with bureaucrats that have to be, of course, followed as a matter of course. With relevant ministries, ministers, and we have inspectors for emergency cases. So we need to make sure that such rules are observed. And about relations between the Prime Minister's office and the bureaucrats, you mentioned a third-party panel. However, we need to watch how it plays out. And about COVID-19, in many cases, beyond health ministries officials, many officials have to work day and night for more than a year now, and they are making a lot of efforts, and I'd like to really respect such a fact.
はい、それではまた前列で
At the front, Shigeta-san from Nikkei newspaper.
日本経済新聞の
Shigeta from Nikkei. You're willing to take Olympic Games here in Tokyo. In July, this game is supposed to take place and safe and secure games needs to be held. So 21st, even after 21st of March, for longer term, you need to control infections. How is it possible? What's the trajectory for that vision? Well, regardless of Olympic Games, as soon as possible, we need to conquer the virus. That's my job. We extended the state of emergency today. By any means, we need to conquer the virus and its outbreak. And even after lifting the state of emergency, we shouldn't have any rebound of infection and its outbreak. So we need to well listen to what experts say, and anti-infection measures need to be placed. And what will be the trump card for the anti-infection measures will be vaccines. Since after 12 of April, we will shut the vaccines for elderly people, and 2 times vaccines will be shot to people who are over 65 years old in June. As soon as possible, we need to shortage jobs for as many people as possible here in Japan. So that's why we are doing all we can. And you asked a question of the foreign tourists to Olympic Games. At some point in March, the decisions will be made. So we need to see by the look of things while controlling border control, and that might be subject to change. And with all possible measures in place now, but once we decide to take foreign tourists overseas, and that will be the very real challenge for us. So first, the directions need to be set forward some point this month.
Nihon newspaper, Inoue-san. Inoue was Nihon newspaper about the state of emergency declaration in the task force meeting regarding the measures you'd like to bolster the measures, and from January onwards there were many tangible effects that you can see. At the same time, the decline, the pace of the decline is decelerating, and in order to lift the state of emergency another 2 weeks, we need to gear up. And for further containment, how are you going to change people's behavior, and what will be the countermeasures? If you are not taking any countermeasures, what will be the reason? About the behavioral changes. About behavioral changes. Up until today, we have a lesson learned, and we need to stay focused. We stayed focused on E3s, and that's how we were able to shrink the number of new infections to stage 3 or from stage 3. At the same time, we'd like to renew our focus on the elderly care centers. For this area, as a central government's responsibility, by the end of this month, in 30,000 locations, we will stage a testing on a regular basis and in a thorough manner. Cluster-prone areas should be eliminated, and to youngsters, we have some downtown streets or entertainment districts with a lot of youngsters, and under a strong demand from Dr. Omi, monitoring and new testing will be conducted. And now we are having ongoing efforts around washing hands and a version of 3Cs and wearing a mask. So such basic anti-infection measures have to be thoroughly implemented so that for another 2 weeks, as things stand now, we'd like to further prevent the spread and bed occupancy ratio 50% or around is the situation in one location, and we'd like to ramp up our efforts to rectify the situation for another 2 weeks.
それではそちらドワンゴの7。
Nanao-san from Duango, go ahead.
連日お疲れ様です。
Thank you for your efforts in every single day. This is Nanao from Duango. Being aware of the situation on site, the policies were determined by local governments that is very close to very infections, and there were mounting elements that the local governments can do. But other than Osaka, Hokkaido, little efforts for local governments were not broadcasted, and no responsibility were shouted. And there is a investigation committee that is independent in other international organizations to look into that. and monitoring and analyzing your policy in a real-time manner and reporting to national public. I mean, these systems will be required. So societal science committee, that is the top of the social science body, I believe this will be ideal for the committees to report and do that works. Well, anti-infection measures need to be implemented, and what will be the challenges that need to be sorted out. So in order to proceed these anti-infection measures, local governments are the ones who are aware of the situation at the moment. So their roles are very important. So central governments need to work hand in hand with them to strongly support and ramp up efforts for them. For instance, last December, the number of beds in Tokyo were very, very overstretched. Tokyo government and central government and local governments have worked together. And then we discussed new aid, and within 1 month, we are able to increase 2,000 beds. So that was a very important measure, I believe. But at the same time, the various infection measures need to be assessed and need to be advised by experts. So Ministry of Health has a subcommittee and experts panel. These are the bodies that we have at the moment. So local governments' efforts were also included in agenda to be assessed. And we need to develop what's been successful. So these are the practices we need to share and we need to penetrate. And so that's the coordination that we have made with the local governments. So as an anti-infection measures, financial supports were shouldered by Japanese government. So cooperation and coordination will be very, very of importance. Dr. Omi, would you like to supplement? Yes. At my position, that we see people working on the front line and we need to be aligned and we exchange opinions with them. And as you raised the question, Azov, within the local governments, very excellent efforts were proceeded in some local governments. And if that's the case, there were no exceptions. But leaders do exist in those local governments. Proactively, they analyze situation and they mobilize the teams by leadership. So these teams or local governments have made a great progress and they were able to quell the virus. And also, anti-infection measures were beautifully done in elderly people facilities. So we need to coordinate with them and we need to assess their efforts and we need to develop that and apply that into the other local governments. So that's sustainable efforts that will be required going forward. That's being underway right now, but we would like to ramp up efforts moving forward.
Sankei newspaper, Sugimoto-san. Yes, Sankei newspaper, my name is Sugimoto. To overlap a little bit with what was asked about the relations between the central government and the local municipalities, in this third session about the Infection Control Disease Act and one more act were talked about. And in order to enhance the effectiveness of the ongoing measures, so that was the whole purpose. And the authority review was not done. However, from Tokyo, the bed utilization data were 40 in some cases, and they couldn't reconcile enough. And before the state of emergency up until 8 p.m., so there is no request for shorter working hours. I think there are different issues coming up. What I want to ask is this. The role of local municipalities is important, which is a fact, but the authority of the central government has to be bolstered. And so enhancement of your authority. In this regard, do you have any intention to review the institution? First of all, regarding the ongoing COVID-19 anti-countermeasures, the basic policies are decided by the central government, and it is executed by each local municipality, and we do support such measures. And in Special Measures Act, there is such aspiration, and about securing enough number of beds, we have to provide enough financial measures and supports, and the specifics have to be worked out in each local municipality, and the beds have to be secured depending on the situation of infections in each region. That's how we work in between. So we provide financial support as a central government in the field. That is a prefecture, of course. However, best practices, of course, need to be shared from the central government with each prefecture, because once a cluster infections happen, then we dispatch the experts from us. So within such a framework, we share the roles and responsibilities in the right manner. But between the central government and the local municipalities, we try to liaise with each other to secure enough number of beds. However, once containment is accomplished, necessary verification needs to be done, I think.
はい、それでは奥の、
Far left, Otsuka-san from JG Press.
時通信の大塚です。
Otsuka, JG Press. The Vice Minister for Policy Coordination was entertained by NTT. There was an entertaining issue. But Mr. Taniwaki, I wonder if he continues to serve in this position. That's my first question. And some people say investigation was not enough. But how do you see the minister's responsibility for the issue? Yes, to your point. Currently, investigation is underway. So I would like to hold back my comments here today. And Minister Takeda has exerted his leadership to get to the root causes, and rule-based manner responses need to be made.
Video news, Jimbo-san. Thank you. Video news, Jimbo. Prime Minister, in relation to what was asked, so broadcasters entertaining bureaucrats on this front, of course, supervised organ entertained the supervisor, which is a problem. However, broadcasters, why do they have to entertain the bureaucrats? What is the motive? I think there are many, especially in the Japanese society. Among advanced nations, I think this is something abnormal. In 1950s, there was a separation provision about the Japanese government providing a direct licensing to broadcasters, so which is a unique system. So that's why you have a strong authority over broadcasting industry. Here's my question, Prime Minister. So in 1950s, so those systems were established, and we have different times, and BS and CS and internet broadcasting has been enabled by the current systems. So such a strong supervisory authority, should it be owned by the MIC Ministry? What is the rationale behind it? What is your take? And Japan, so licensing authority, just like the Western countries, so radio management panel. So maybe we should set up the third-party panel, and you can attach the authority. And the deregulation is one of your agenda items. For example, radio wave auction can be implemented so that the new entrants can be somehow motivated. And if not, what is the reason? First, about the information-related industry, including broadcasting industry, we have quite a high competition in the international community, which requires a lot of options. So unified and comprehensive and agile measures need to be staged. And under the responsibility of Minister, in a swift manner, measures have to be staged. That's how we work in Japan. As a matter of fact, Japan, we used to have an advisory or administrative panel. So that was widely introduced back in the past. However, that way, we have ambiguity around who is accountable. So that's why it was discarded. However, regarding radio wave itself, we have internet age and we have no border between broadcasting and telecommunications. We have such an evolution as a matter of fact. So therefore, of course, we need to take that into account to review the system.
はい、それでは前列、テレビ東京
Shinohara-san from TV Tokyo.
テレビ東京の篠原です。コロナの
Shinohara, TV Tokyo. Additional economic measures against COVID-19, as some LDP and CDPJs have said the limited additional measures will cash out for poor households. How do you see that? And that's my first question. And second question is that I believe the reducing tax will be the one measure. What's your view on that? Well, people who suffer from COVID-19 and these financial support will be offered to maintain the jobs and employment, especially people who are struggling in daily lives. And a limited amount, 2 million yen, that's the new limit for individual funds. And also for some households, we put some moratorium for repaying the debt. That's one of the measures. Also, rent backup payout is delivered now. And also, I touched this in my speech. Impacts for employment is huge. Regular and irregular female employees who are affected a lot by COVID-19 and loan and isolation, and these are issues that come into the fore here in Japan and for some people. So we need to take actions after considering and contemplating measures for them. And at some point in this month, we would like to formulate measures. And not only that, information technology related support that is leading to employment. That's one measures we would like to offer. For irregular people, for single parent households, we would like to offer and deliver support for them. And you asked a question of the consumption tax. And as a revenue for Social Security and free education for kids, and also tuitions have been lowered. And for some children, for 2 trillion yen has been already in the reserve funds available.
はい、
TBS 後藤さん。TBS 後藤。From now on, another 2 weeks, I think our outcome will be expected. Good outcome. However, beyond 21st of March, I think you need to exercise another decision. In February, there was a holding of special measures based, a special measures act related to key measures for prevention of the spread of COVID-19. Is there any room to consider such fronts? Here's my question for both of you, Dr. Omi and Prime Minister. First of all, I will answer the question. As part of the Special Measures Act, key measures were discussed. And as part of the basic response policy, if we have a stage 3 for infection status in some prefectures, even when we have a declining trend, in specific areas in the prefecture. For example, in Tokyo, we have Shinjuku ward, and centering on Shinjuku, across the board testing will be done. So therefore, rather than across the board measures, we need to focus on specific regions to take a measure. As part of that, vis-a-vis anti-infection measures, I think we have big achievements in this regard. But 2 weeks later, because we will be able to have another countermeasure, if we have another resurgence, then we will be able to somehow eliminate clusters in different regions. So in that way, we'd like to exercise our flexibility. And whether or not we should apply specific measures, I will not comment at this point of time. However, in an agile manner, we should be able to have that structure. And before having a resurgence, we will be able to contain the spread. I think that way we will be able to make it effective. Dr. Omi. So key measures for the prevention of the spread. On this front, including myself, the subcommittee has a strong interest in key measures because last year, regrettably, we had to. So one of the reasons that we didn't stage another declaration, at the end of last year, we provided ideas about how we consider stages. And as a background, state of emergency declaration, before the declaration, we will have a stage 3 or buffer. And if we reach stage 3, compared with what we have in stage 2, we can probably call it a quasi declaration status. So upon that juncture, we need to provide additional measures in order to avert another declaration. However, you mentioned the authority between the state government and the local municipalities. But for many reasons, in terms of providing strong measures, we couldn't really unify all the efforts. However, and it actually relates to the role and responsibility sharing between the local government and the central government. But anyway, stage 3. So after taking quite strong measures, we try to avert stage 4 or the declaration. However, it didn't work on many different fronts. So that's what we feel. So we have 2 weeks of extension now, and then at the end of the day, it will be lifted, and we will have a big lesson learned after all. So these key measures, before having a big wave, the central government will take a decision and collaborate with local municipalities. So that's how we will be able to reflect what we learned last year onto the future measures. And eventually, there will be a lifting of the state of emergency. I think this is one of the very big requirements.
恐縮でございますけれども、かなり長時間にわたって。
I'm afraid press conference goes on for quite a while. So 2 final questions. Second brawl, Kyoto newspaper.
すみません、京都新聞の国皿と。
Kunisada from Kyoto newspaper. My question concerns bed occupancy ratio. The end of February, in Tokyo, beds occupancy ratio for the critical has been based on the central government criteria, so the occupancy ratio has dipped. Then 2 days ago, in the budget session of the Diet, the question was raised on that, and Minister of Health has answered that question at the time. This bed occupancy ratio revision is not something new, but after January, Kyoto Prefecture and Kanagawa Prefecture, this has occurred actually. And in case of Kyoto, occupancy ratio has jumped high. Why? Because the central government had set the criteria, but that goes without any explanation, and that has been revised. Now, this bed occupancy ratio is very important index that is in function of a state of emergency. And of course, not only Prime Minister, but experts pay attention to this index. But this very important index has fluctuated. Maybe it depends on how the reports were made from region to region. And if that revision continues, and this is a matter of trust for that index, lest it occurs again, would you like to specify this criteria? Would you like to standardize this criteria? The bed occupancy in each region needs to be assessed with a standardized criteria. And a number of times, Ministry of Health, and usually in the past, the Tokyo government had set their own occupancy ratio criteria. So we asked the Tokyo government to report that number based on the central government's criteria. Then the middle of February, Tokyo government has conformed to the central government's criteria, and the end of February, the reports were received. And then this time, this operation goes on based on the central government's criteria. So I would say almost all the regions were following the central government's criteria, and I asked the other remainder of prefectures were following the central government's criteria.
岩上さん。
フリーランサー岩上さん。IWJ 岩上。There was a mention about a version of rebound. I truly agree. And the key determinant is vaccination, you said. Having listened to what you have said, well, I have some question mark. Vaccines do not solve every issue, because many people feel that way. But as a matter of fact, vaccines can prevent a complication and other areas. However, infection itself will not be prevented. On February the 4th, according to Minister Tamura, and he responded to our press question. So there is no solid evidence to prevent the infection. And Pfizer vaccines, so there was evidence or there was some effect of preventing the infection. However, this is before proofreading, and I confirmed with the person in charge in the Health Ministry, and this person has said, as a state government posture, there is no effect of a preventing infection. So there is no intention to revise such posture. So that means, so there will be more people who will not have symptoms. So that will balloon asymptomatic patients. So that might spread the virus. On the flip side, at the same time, for asymptomatic patients, indiscriminate PCR tests have to be done en masse. So PCRs and vaccination program have to take place at the same time, and there has to be an expansion on this front. And then that way you can detect the positive cases. And that way, I think everything will make sense. And Tokyo University, So if you slacken your efforts, if you are off guard for March, then what's going to happen? So there was such a survey or result published and covered by NHK program. And in April, if you slacken all the efforts in July, so we will have 1,200 cases per day. And as part of such a, slackening your efforts, people might think that now that I was vaccinated, I should be all right. So I don't have to wear a mask anymore. So that might happen, such kind of mindset. So therefore, the government needs to bear that in mind and gives a right announcement. And on December 25th of last year, would you be able to proceed to your question part? It's about ramping up the capacity of PCR, I mentioned, however, at that time you said that we don't have to opt for the all-out inspections. Did you change your mind? And for all stakeholders, so there will be a very stringent testing. However, that's not going to happen for spectators, you said. However, if you have to invite spectators, I think all-out testing has to be done. Because in the private sector sports events, right before the entry, everyone is tested. So therefore, including that point, would you be able to elaborate on what you think? I myself, for exhibiting symptoms and in terms of exhibiting symptoms or having complications, there is a preventive effect. So that's the vaccination program is all about. So therefore, as soon as possible, to the people of Japan, we'd like to provide vaccinations program. At the same time, the test needs to be ramped up. In the beginning part I mentioned, for the elderly care centers, we'd like to have an intensive testing in 30,000 locations by the end of this month, I said. And furthermore, in entertainment areas or districts, monitoring and testing will be staged in major cities. That's what we want to do. Thank you. So now this concludes. Sorry, Dr. Omi. So regarding the 2 points that you have mentioned, so once you get vaccinated, you will be able to fend off the infections at all. On this point, Prime Minister has already mentioned, and to your point, this vaccination, I think, is a very promising one compared with what I projected in the beginning. It's safer and it's more effective, to your point. So complication and exhibiting symptoms can be alleviated and prevented. So this is important. But having said that, using a common sense, I'd say 90% of the Japanese people, so I'd say 70% of the people would get vaccinated if that it is a case. I mean, setting aside kids. But even so, from time to time, I think that we will have cluster infections because infectivity being alleviated. At the same time, 30% or so, such people will not get infected. So as a message, regarding the vaccination, risk communication is very important. About side effects, of course. However, even after you get vaccinated, the basic anti-infection measures like washing your hands and wearing a mask, so that has to be done. So for the time being, nobody knows actually. However, I would say by the end of this year, 60% or 70%, so let's say 70% of Japanese people who desire to get vaccinated, things that will push down the infections. However, it will not eliminate all the infections and cases. However, people shouldn't be off guard, and anti-infection measures, basic ones, have to be continued. Of course, side effects have to be communicated, and that has to be communicated by the central government. And about the testing, from time to time, we have talked about this regarding asymptomatic patients. This is important. I mean, among asymptomatic patients, what's required right now is so once the testing is done, relatively high in high positivity areas or infection-prone areas, it has to be done in a frequent manner that is effective for prevention of the spread of the virus. And in Gifu and in Tochigi, I think it's taking place. So depending on the decisions of each municipality, so we provide intensive testing in order to alleviate and push down the total number of infections, I guess. Of course, ideally, it would be ideal to vaccinate everyone across the board. However, it has to be done on a continuous basis. So what's important right now is, of course, it has to take place for symptomatic patients. However, for asymptomatic patients, in an intensive manner and in a frequent manner in infection-prone areas, we need to get it done frequently. I think that would be effective for the spread of the virus. Thank you very much. Now we'd like to conclude the press conference today. So the people raising your hands, I'd like to ask you to send a question by email, and Prime Minister will send answers to you, and we will also discuss what we answer over the website. Thank you very much for your understanding. Now we'd like to close the session for today. Thank you very much once again for your cooperation.